There are some secret messages hidden in some of these questions. This is really fun. So, like I said before, these are real people, real questions. This question is, and I love this, Catherine, this is amazing. Thank you. This is amazing to be talking to you. The question is, I've been having pelvic pain for years. I'm in my 20s, and I'd like to understand more about my pelvic pain. So, thank you. And I also think the Ask the Doctor series is amazing. And I also think it was amazing to bring this to the Deloitte community that catalyzed this entire conversation. When it comes to pelvic pain, though, let me get serious. What would happen in a workup for pelvic pain would be to think about all the organs that are in the pelvis. So, what's in there? Bowel, you really need to have a colonoscopy, see a GI specialist or a colon and rectal surgeon. Bladder, a urologist or a urogynecologist. Is your bladder functioning properly? Do you need a bladder assessment? Is there some form of incontinence or overactive bladder that's happening at the same time? As far as bowel, could it be an inflammatory bowel disease, an irritable bowel disease? These are different. You need GI to help work that up. Could it be something worse in your bowel? Cancer. Have you had colon cancer screening done? Could it be constipation? I can't tell you the number of patients that are so perfectly treated by copious care of their bowel and ensuring regular soft bowel movements. So bowel, bladder, what else is in there? Uterus tubes and ovaries. So an ultrasound to look at uterus tubes and ovaries, a good evaluation of what's happening with your menstrual cycles and menstrual pain. That question is coming next. And a good evaluation of what could be contributing to pelvic pain related to uterus tubes and ovaries, things like endometriosis, adenomyosis, which is endometriosis but in the muscle of the uterus, ovarian cysts, which are common, and ovaries grow cysts every month. It's their job to do that, but sometimes a cyst can get out of control. It can get too large, or it can get cystic, or it can leak, or it can bleed, and that ovarian cyst can cause pain. And some infectious causes. So, some of the sexually transmitted infections can cause pelvic pain and they can kind of fly under the radar for a while, be quite asymptomatic until they start to cause a pelvic inflammatory disease. Other things that are in the pelvis, like nerves, there's sometimes pelvic nerve pain or neuropathic pain. This is where your pelvis sets up like a highway to your brain to say, hey, this hurts, even if there's nothing that is found on imaging or investigations in the pelvis, there has been previously. And so those nerves are just lit up and they continue to say, my pelvis is hurting, even though the pathology has resolved. And that's called neuropathic pain. There are other potential conditions in the pelvis as well. Some people I've seen have vascular, so venous congestion in and around the pelvis sometimes, or even things like varicosities. How you see people with varicose veins on their legs, you can get varicosities in the pelvis. Sometimes they're completely asymptomatic and we just find them on ultrasound, but sometimes they can cause some congestion or a swelling feeling. There are other things, but when we talk about a workup for pelvic pain, we want to be looking at the organs that are in the pelvis, what could be contributing. And if you're someone who has chronic pelvic pain, every single one of the things I discussed needs to be addressed because you never know whether there's, a cumulative problem that over time, if you start to manage bladder and get really healthy with your bladder and bowel and very healthy bowel, and your menstrual cycles are managed or suppressed, suppression of the menstrual cycles is another great way to ensure that you don't have menstrual cycle pain. Again, that question's coming next. And physical therapy. Pelvic floor physical therapy is remarkable at helping people who have otherwise incurable or otherwise incapacitating pelvic pain. So I've thrown a lot at you because pelvic pain is an entire huge lecture in and of itself. I won't give you the whole lecture that I give to the residents, but if you're someone who has pelvic pain, You need to have that evaluated in a multidisciplinary fashion. Start with your family doctor and move up to gynecology and specialists in pelvic pain. So I hope that's helpful. And I really love the hidden message in here that you think that this has been amazing. So do I. Like, follow, subscribe, and let's get to the next question.